periodontist with over 25 years experience in state-of-the-art oral health. He's here tonight to talk about not only where we stand with COVID-19 and access to dental care, but he'll also be explaining the serious connection between gum disease and most of the major diseases of our time. Dr. Nemeth will talk to us directly about where his research has led him with respect to avoiding these silent killers, and speak with the doctor directly. You won't want to miss what Dr. Nemeth has to say, and if you have a question for the doctor, we're inviting you to call 800-859-0957. So stay tuned. We'll be right back after this short break. You're listening to News Talk 760 WJR.
Volume down, hopefully.
Okay.
Are we going live right now during the breaks?
Where's Skylar? We are? Okay, we're live on Facebook.
Okay.
Skylar has to come out and join us. Earth to Skylar.
Yeah, I'm just looking for the live feed to...
Gotta go. We're on Facebook Live now.
So we're back in less than 2 minutes, so it's going to be a short segment here over the live stream. So we'll just get our bearings.
Are you walking around with the...
Okay. All right, so we're back in about a minute and a half. So what can we look forward to in this episode with Dr. Nemeth?
Idea. It doesn't make any. No, but really, I want to talk about saving people's lives because gum disease kills people. That's the problem.
Does.
It's as I've said before. What's the silent killer? High blood pressure. Everybody knows about that. What's the other silent killer? Gum disease. Not everybody knows about that. It doesn't get enough attention, but it's incredibly destructive. You have gum disease. Normal life because it affects your whole body. So people need to become aware of the threat of gum disease. I want to write a book. I was telling you, and
the silent killer, yeah,
called the other silent killer, not the silent killer. They'll think it's high blood pressure. It's prevalent, just as prevalent as high blood pressure, and perhaps even more so. And extremely
We're about to come back
damaging.
on the air, not to cut you off, but we'll continue that when we get back on the air.
What do we have, like 10, 15 seconds?
Yep, probably something like that.
Welcome to this special edition of the Dr. Nemeth Radio Show. I'm your host, Anne-Marie Cronin, and we are here tonight talking with Dr. Joseph Nemeth, board-certified periodontist in Southfield, Michigan. Dr. Nemeth is with us discussing his state-of-the-art clinic and the latest treatments in periodontic care. He's also going to be talking and many systemic diseases, from cardiac disease to the prevention of Alzheimer's. If you have a question for the doctor, 800-859-0957. Dr. Nemeth, welcome back again. Your shows are always very informative, and people need to know what you have. All of the catastrophic diseases of our time. So I'm going to give you the floor and tell listeners what they need to know.
Well, as I was just saying, just people need to know about how bad gum disease really is for them, besides just their gums and just besides their mouth. As I was saying, and I don't know how many people are, heard the first part of this, but gum disease affects virtually every gum disease. You have an infection. You have an infection in your mouth. And the infection isn't just in your mouth. The hip bones is connected to the whole body because the mouth has a blood supply, and that blood supply goes throughout the body. It carries the bacteria, the pathogens, it carries them throughout the whole body. It carries them to the lungs. It carries them to the brain. It carries them to the heart. It carries them, depending on severity. But as I said, it can reduce your lifespan by 4 years, 5 years, 6 years, up to 7 years. It can take, and not only can it cause you to, die earlier, but occur more frequently, can make the last years of your life much more unpleasant and much more unhealthy than they would be otherwise. So gum disease needs to be recognized. It needs to have the recognition that high blood pressure has, because it's also very deadly.
No doubt about it. But my question to you is, to the listeners and to the average person out there, what is the subjective experience of someone that has gum disease? And
Isn't that what's that called, an oxymoron?
probably,
How does someone who doesn't have any signs know they have gum disease? Well, they don't know they have gum disease. That's how they take an example today. This was a totally great example. A man comes in, very intelligent guy. I think he's a software engineer, and he came in and said, well, he said, well, I have one tooth, it's a little bit loose, when it seems like it's a little bit loose, and I thought maybe I would get that checked. Now, you look at his mouth looked great. The gums looked great, no problem looking. So I said, does that tooth ever bother you at all? He says, well, sometimes if I bite something really hard, I can feel it there. So I examined him, and he had bone loss throughout his mouth. The tooth that he was talking about felt a little uncomfortable. That tooth was already hopeless. That tooth could not be saved. That tooth has to be removed. We took a sample from under the gum. We looked at it under the microscope. We showed it to him on the television screen. He had no idea about the devastation in he's talking about his was incredible. That tooth has to come out. He's on the verge of losing a number of other teeth, but we're going to try to save the rest of the teeth by eliminating that infection using the laser to kill those parasites and bacteria, and then teaching him how to take care of his mouth. So this man had no idea of what was going on. He just had a little bit of looseness in one tooth and just wanted me to check that out and make sure there was nothing serious. So
I would have to imagine that most of the swab sample of what's inside their mouth and then show them on a television screen. I mean, I'm still shocked by this, because I'm imagining they're all.
some of them think they do, but when we check them, they're actually okay. It's a minority of the people that come to see me, because most of the people who come to see me either know they have gum disease because they were told by their dentist, or they have bleeding gums, or they just want to get it checked. But there are some people that come in, we take a slide, and hey, nothing's going on. You really don't need anything. Your mouth is in great shape. Not the majority, but there certainly are some people that really don't have a significant problem. And then when I do find, then when a patient says, well, doesn't everybody have that in their mouth when they do have bacteria and parasites? I said, well, I don't. And if you're really healthy, you don't. You don't have those bacteria. You don't have those parasites. So it's not necessarily the case that all the patients that come into.
Yeah, but we're talking about very serious diseases. We've got a list here in front of us: cancer, Alzheimer's, arthritis, colon cancer, osteoporosis, everything.
I think it would be better if you could find a list of diseases that were not affected.
Exactly.
I mean,
I'm thinking
any disease that really isn't made worse and you're more susceptible to.
back and talk about this on the other side of the break. Very interesting. In the meantime, you are listening to the Dr. Nemeth radio show. We're talking about how the treatment of gum disease can prevent some of the major diseases of our time. If you have a question, you can reach. Again, that number is 800-859-0957. So don't miss this opportunity to call the doctor directly. You're listening to the Dr. Nemeth Okay, we're back on Facebook Live. Yeah, we
Yeah,
need
we're
to
back
just,
in. No, go on. But I was going to say we do have a question that came in through the Facebook feed. If I can ask it to Dr. Nemeth.
Sure.
So a lady here, Beth, is asking. She says, "I don't think I have gum disease, but since it's the other silent killer, should I get a periodontal exam to be sure there isn't anything brewing? Is it an annual thing I should add to my other preventive care?"
Without a doubt, absolutely you should. So I would, even your general dentist can check for periodontal disease. And of course, if you want to go to a periodontist and get someone who specializes in that, that would be ideal. But yes, I think one should have that kind of a checkup annually. So I'm going to, in a moment, remind me to talk more about that.
okay.
Okay. Well, one question that came to me, if I can ask, you mentioned having parasites in the mouth. Other than, let's say, getting checked and brushing and flossing, where might be the source of things that are causing gum disease? Is it things that we're doing in lifestyle that might be contributing to that people can work on?
The truth is, these bacteria, these parasites are, patients ask me that all the time. They're everywhere. They may be in food that's been lying out. They're in pets. You can get them from kissing. They're in the air. You can't avoid them. It's not a matter of, well, what can I do so I'm not exposed? You cannot avoid these bacteria, these parasites. You can't. What you want to do is avoid letting them get under your gum, because once they get under the gum, they're protected. They're in a great environment for them to multiply and breed and cause infection. So you can't avoid them, but you can avoid letting them get started, causing an infection by not letting them get under your gum and cause disease.
Driving back up from Columbus, I noticed this billboard about how we have a heart attack every like 45 seconds or something in this country, and we still have 650,000 people dying of heart disease and heart attack. And so, but how much of that would you say started off somewhere in the gums? I guess all of it. I mean, it's hard to put a
I
number.
can't say it started. We know long ago, before they realized that gum disease might be a major factor in things like Alzheimer's disease and dementia and high blood pressure even.
About 20 seconds till we're back.
Okay. Seconds, you need to wrap it up because that's our close. Nemeth radio show. I'm your host, Anne-Marie Cronin, and we're here tonight talking with Dr. Nemeth, board-certified periodontist in Southfield, Michigan. Dr. Nemeth is with us discussing his state-of-the-art clinic and the latest treatments in periodontic care and the relationship between gum disease and many systemic diseases, from cardiac disease to the prevention of Alzheimer's. If you have a question for the doctor on the topic we're discussing tonight, please call us at 800-57. Dr. Nemeth, over the break, we were talking about what's the reliability. I know a lot of people, is all cardiac disease and heart attacks, does it all start in the gum? And I know you can't quantify it, but
We don't know that. We just know that there's in heart disease. We're finding bacteria from the mouth, bacteria from gum disease in plaques that form in the blood vessels that go to into the heart and that contribute to heart attacks and heart disease. So statistic is, but if you have gum disease, you're 50% or 80% more likely to have a heart attack or have heart disease or cardiovascular disease or a stroke than if you don't have gum disease. There's a very strong correlation. But one person called in and said, well, should she have an annual checkup by a periodontist? Honest, or a good general dentist, they should check for that. Well, what happened? I mean, every time I go, they check my blood pressure. You
Right.
go for a physical, they check your blood pressure. You go in for almost any reason, even has nothing to do with your blood pressure, they'll often check your blood pressure. So they're very aware of the blood pressure, and you become very aware of the blood pressure. That is not the case with periodontal disease. Periodontal disease is extremely damaging and destructive. The problem is it isn't monitored, it isn't checked for as blood pressure in the mouth, and physicians, that's not their specialty.
Well, I know we've had many shows where we've had medical doctors on, and they've all brought this subject up in the past, and in passing, about the fact that it's so important to have an examination of the oral cavity and to find out what bacteria, what microbes are in the oral cavity, because once they get, when they get into the bloodstream and they start to cause Alzheimer's, there's no turning back. There's no prescription. There's no cure. There's no, once you get it, you've got it. You live with it until you die, but there is no cure. And so, you know, I understand that heart attack is a major issue here, but some people survive heart attack, but you can't survive or turn the clock back.
Medication, I think, that was recently approved for the treatment of Alzheimer's, but its effectiveness is extremely questionable, and whether it works and how effective it is, we really don't know. But the created early on, because it's so slowly progressive, it can take 20 or 30 years from the time it gets initiated until the symptoms manifest themselves. So it may start in your 20s or 30s and not manifest itself until your 60s or 70s, but it starts early. And the theory is that one of the factors, and maybe the factor in many cases, are bacteria, Porphyromonas gingivalis, or PG. They get into the brain from the infected gum tissue into the bloodstream, into the brain, where they then cause a certain kind of reaction that causes amyloid to be laid down slowly, gradually, entanglements in the brain, leading to Alzheimer's. But once it starts, it tends to progress. Sometimes it progresses more or less rapidly, but I'm sure get your gum disease under control, it may progress less rapidly than if you don't have your gum disease under control. But the sooner you catch gum disease, the more optimistic one can be about minimizing all kinds of diseases, including Alzheimer's or dementia.
I think that people have to take it upon testing done to find out whether they've got the bacteria, because they're not going to find out on their own, and they're not necessarily going to be referred for this type of screening by their dentist. And I would think that a lot of listeners are sitting at home thinking that, well, I brush my teeth every day and I use a very strong mouthwash, and probably that alcohol-based mouthwash is killing whatever's in my mouth. But explain to the listeners it does not kill the bacteria that are in your mouth.
Well, it doesn't kill, it may kill the bacteria in your mouth that it can reach. That's where the damage occurs. That's where the destruction occurs, underneath the gum, fairly deep under the gum. These bacteria, these parasites, these amoeba, these trichomonads, spirochetes, PGs, they're under the gum where mouthwash typically can't reach, and they continue working their damage and being extremely destructive down under there. So we take a swab, we take the gum, it's not painful. We take a sample of what's under there, and we put that under the microscope, and we take a look at it. And very often, you know, sometimes there's nothing there. When we look at the microscope slide, we look at it on the television set in front of the patient, and the patient sees what I see. You know, there's lots of activity and lots of breeding and infection of these organisms.
It'd be pretty shocking, I would imagine, to patients to sit and look at a big screen in front of them and see these live microorganisms swarming around in their mouth. They must be completely shocked at seeing this.
Most of the time, they're pretty because they see that and they say, "Oh my God, that's going on in my mouth. I want to get rid of that. I need to get," because they don't realize they have it. It doesn't cause pain.
Right.
The problem is it doesn't cause pain. If it caused pain, people would pay attention to it. They'd get it attended to. But as I said, it's a silent killer, extremely destructive. It does its damage in a very silent, clever kind of way.
Screen and sees all these microbes floating around. How difficult is the treatment? How long does the treatment take? What happens? What's the next step?
Well, in most of cases, I can't say in every case, but most of the cases, we treat this with a laser. Organisms, it kills these parasites, it kills these bacteria. It tends to close the gum pocket where these bacteria lodge, hide, and multiply. It's not painful. Usually there's no pain involved. We give the patient something to relax them, IV sedation so they're comfortable, and they're there for hours while we use the laser to kill the bacteria and then thoroughly clean out the material from these pockets, then allow it to heal, and then we teach the patients how they need to take care of their mouth to prevent recurrence, because if the gum disease will come back as it initiated in the first place.
So you kill all the bacteria. When they leave your office, what's their next step? What are they responsible for doing in order to keep it from starting up again?
We use the laser to kill the bacteria, to close the pocket, and we allow that to heal for 2 weeks without the patient brushing. That sounds horrible, but we give them something to rinse with that will kill any bacteria. So for a 2-week period, and for that pocket to close without being disturbed. 2 weeks later, the patient comes back in. We then teach them what they need to do as far as their home care is concerned, and that may vary from patient to patient depending on the condition that they have, but typically we teach them certain cleaning techniques, using certain materials to clean between the teeth, using water irrigation devices, toothbrush, okay, you're cured, basically.
Stay on top of it.
The infection's gone, but now it's up to you to stay healthy.
In the meantime, you are listening to the Dr. Joseph Nemeth radio show. We're talking about how the treatment of gum disease can prevent some of the major diseases of our time. If you have a question, you can reach Dr. Nemeth by calling 800. And that number is 800-859-0957. Don't miss this opportunity to talk to the doctor directly. You're listening to WJR.
Okay, so we're back on the live stream.
Our next segment is segment 4, right?
That's right. And we do, from the same lady that asked earlier, she had another question. Is periodontal disease genetic? Can it pass down from generation to generation like some other diseases?
There is, in my opinion, definitely a genetic predisposition to periodontal disease. And so one of the questions we always ask patients is, did your parents lose their advanced cases? Even though the patient may be trying to take good care of their mouth, there's a lot of bone destruction. In most of those cases, yeah, my mother lost all of her teeth when she was young, or my father did, or both of my grandparents lost all of their teeth. So there is a genetic So yes, it doesn't mean they're going to lose their teeth, but with that genetic predisposition, they may have to work a lot harder to keep their teeth than someone who has that resistance.
So the average person listening to this show, they really need to take it upon themselves to make an appointment, get this testing done. It's crucial that they have this testing done.
I'm not saying it's crucial that they have this testing done. They're periodontal disease or not. To me, this is the most important and reliable indicator. But when you go to your dentist, when a patient goes to their dentist, the dentist can take small instruments and kind of measure under the gum and see how much bone destruction or how deep these gum pockets are, or periodontists can do that. So I don't like to say. Me, I think it's the most effective, but I would never want to say that that everybody should have this done. And my own feeling is I think it's valuable and helpful, and that's the way I proceed.
Well, in my opinion, I think that these diseases are pretty devastating. And, you know, my neighbor next door got Alzheimer's. She was a school teacher, and I want to tell you that for 8 years, she lived in absolute misery. It's a long and horrible and degenerative disease. And who would want to take the chance or the risk when you've got something that sounds like it's simple, easy peasy, come in? No, but I mean, it really is.
Yeah,
Seriously.
you know something, I'm not going to say, come in, if we cure your gum disease, you're not going to have Alzheimer's. I mean, we can't make a blanket statement like that.
Well, you're
We can
giving it-
only say that if you have gum disease, you're more likely to have Alzheimer's. That's just the way it is. And if we can stop the gum disease, it will help to reduce statements like that. There's no miracle cures.
Well, there's no miracle cures, but there are somewhat miracle preventions. I mean, we've got the technology here now to be able to do something preventative that maybe wasn't available 20
Well,
or
that's
30
true.
years ago.
That is very true. I think it for people to have a healthy mouth. I can't not emphasize that too much. I make lots of videos. I've got a couple of subscribers
Wow.
who watch me. And I always say, if your mouth's not healthy, you're not healthy. You cannot be healthy if your mouth's not healthy. It's impossible.
When are we back?
Probably about 30 seconds. You're back at 33 after.
I think we need to talk about your YouTube channel and the film. Don't you? Welcome back to this special edition of the Dr. Nemeth Radio Show. I'm your host, Anne-Marie Cronin, and we are here tonight talking with Dr. Nemeth, board-certified periodontist in Southfield, Michigan. Dr. Nemeth is with us discussing his state-of-the-art clinic, the latest treatments in periodontic care, and the relationship between gum disease and many systemic diseases, from cardiac disease to the prevention of Alzheimer's. If you have a question for the doctor on the topic we're discussing tonight, please call us at 800-859-0957. Dr. Nemeth, a lot of the very sophisticated testing, not everyone has it. And, you know, I would just like you to explain to the listeners out there, you've got over 100,000 or 150,000 people, subscribers to your YouTube channel, and it's very prolific with visuals of films. And I think we should encourage people to take a look.
Well, I couldn't agree more. Who helps with my videos and has been a key factor in my subscribers. I said, well, how many YouTube subscribers do we have now? He said, well, today we just hit 150,000 YouTube subscribers.
That's
and
amazing.
We have, how many videos do we have? So Skylar's here. We have about 300 to 400, 350 or so videos, primarily talking about different aspects and a number of other things. We have some that are actually kind of funny too, where we did a hot chip challenge, which was
that?
Which was right. That's where my partner, Dr. Katranji, who does dental implants and is, I think, the best in the state and in this whole part of the country, he and I, the staff members, and we had these incredibly hot, you know, taco chips or whatever they are,
my.
and you know, just who could withstand it and who couldn't, and I flunked miserably. But
Okay.
but Dr. Katranji was great. He was able to have it.
Oh,
but he
dear.
looked great during the video. But anyway, there's lots of videos, and we have lots of patients who come to me because they've seen me on video, and they said, well, you know, I saw this, and I saw how you do the laser treatment. I saw how you build up the gum tissue. I saw how you do the cosmetic gum. And so we have a large, you know, gum disease on YouTube, and they find some of my videos. So if people are interested, it's drnemeth.com, I believe.
If you go onto YouTube and you search Dr. Joseph Nemeth, he'll be right up there on
Yeah,
the top.
YouTube, Dr. Joseph Nemeth. I think that's my name, last I was
Right.
told. So check it out, and there's a whole plethora of anybody could find interesting and valuable.
I'm going to jump in. We have a question from the station. When are you going to be on TikTok? That is the question.
Oh,
we
my.
have been doing some TikTok videos.
Yeah, we've been doing
shortened
some
versions.
TikTok videos, and Skylar, who you know helps me with those, has much more information on the TikTok videos. But we did one recently. What was it?
It was juice on swelling. So
Yeah. So someone else had done something. Some lady had taken pineapple juice after some oral surgery or something like that, and she said she thought it helped. And of course, we give something called bromelain, which is a derivative of pineapple juice. We minimize any swelling or bruising, although with the laser procedure, there's usually no swelling or bruising anyway, but sometimes there's more extensive procedures that are done, and we give the patients bromelain, which is something to minimize swell. It's an enzyme from the pineapple to minimize swelling and bruising, and that's on TikTok.
yeah, if you're having wisdom tooth surgery, drink some pineapple juice beforehand, and you'll be better off.
Yeah.
And I remember the
Yeah.
swelling was horrible. So
Yeah.
And-
Absolutely. It helps. It helps.
And did the oral surgeon say anything to you about pineapple juice when you got your wisdom teeth taken out? I don't think so.
Yeah, it's interesting. There's lots of little tips that, you know, aren't commonly known that can be helpful in all kinds of situations regarding the mouth.
I
well, you're
think that,
obviously
go
passionate
ahead.
about, not to interrupt you, about educating people, because otherwise, why would you go on YouTube and spend all this time? I mean, that's a great thing that you're doing. And their information now, they're struggling and they go to Google. That's their first resource,
Yeah.
looking for help,
And I would say probably a large proportion of my patients, I ask them, well, how did they find me? Of course, a lot of them are referred by their general dentist because the general dentist sees a situation that he can't really cope with, and he knows the patient needs something done. But also a large percentage of the patients that we see come from Google. They see, I have, I don't know, what do I have, 1,000 reviews, Beth, on Google? I probably are five-star, probably not my ex-wife, but the other ones probably yes.
Well,
But at any rate, we have a huge number of reviews, and so people these days are looking things up on find somebody that they think can help them, and they often come via Google.
well, I think there's probably still fear out there. I know there are people of a general intervention, periodontal care. I know back in the old days, they used to cut the gum tissue out, and you're not even doing that anymore.
I rarely cut the gum tissue. I'm not saying never, but that would be, most of the time I don't. I'll tell you when I do, when I'm doing cosmetic, the gum tissue shows,
Right.
we will recontour that tissue so that they have a nice smile and they're not embarrassed to smile.
So it's mostly all for cosmetic, but do you feel as though there still is, and I think it's very helpful that you have this. If anybody wants to go on your YouTube channel, they can see just about every procedure, right, Skylar? 'Cause
Absolutely.
Yeah.
You're filming it all.
You can see pretty much everything. And by the way, I don't want to neglect situations where people have lost teeth. They come to me and they've already lost a number of teeth. Or there was a patient in yesterday and there was some teeth simply that were like, if the patient sneezed, that tooth would come out. So sometimes there are situations where a tooth can't be saved in those situations, we like to put in a dental implant or dental implants to replace those. And my partner, Dr. Katranji, who I think is like dental implants, and dental implants are something that I think are really should, when possible, should always be done to replace a tooth that can't be saved or that's already missing.
That was my next question to you. For example, if somebody has lost a tooth on the side of their face and they didn't do anything about it and a couple of years go by, is it too late to do a dental implant?
Usually
I mean,
not. Usually
see.
not. I can't say never, but most of the time, even so that there then is enough bone to put an implant in, and very often there's enough bone without adding bone. So dental implants are almost always a viable option, even after several years.
And so if somebody has lost several teeth, about how long does the procedure take? How many weeks or days does it take to go from no tooth to
Into the jaw, and it takes about 3 to 6 months for the jaw to attach to that implant. It's a metal post or a ceramic post that goes into the jaw. It takes 3 to 6 months for the bone to attach to that. Once the bone has attached to that, then a tooth can be put on the post, and that then you have the implant and you have the tooth, and that from 3 to 6 months to occur. When the tooth is removed, sometimes the implant can be put in the same day that the tooth is removed. Sometimes there's so much bone loss that we have to wait for the bone to fill in where that tooth has been removed, and that can take 2 or 3 months. So sometimes before the post or the implant can be put in, and then another 3 to 5 or 6 months for the bone to attach to the implant. So the longest one might have to wait in a typical situation 7 to 10 months, something like that, to go from empty space to functional tooth. And mostly these implants typically last a lifetime. They're great.
So what is the fear out there then of pain? Is it still out there? Like people were always not. But I guess we're going to a break right now. We'll come back and discuss this on the other side of the break. In the meantime, you are listening to the Dr. Joseph Nemeth radio show, and we are talking about how the treatment of gum disease can prevent some of the major diseases of our time. If you have a question, you can reach Dr. Nemeth by calling 800-859-0957. Again, that number is 800-859-0957. Don't miss this opportunity. And you are listening to the Dr. Nemeth radio show on News Talk 760 WJR. Well, it looked like we stopped.
I don't know what happened there.
Maybe make up for some time.
Yeah, I'm not sure.
Yeah, that was
But
strange.
we're back live on Facebook, and we do have another question. Dr. Nemeth says the LANAP treatment is for periodontal disease, but also grows bone. Can someone get LANAP if they don't have gum disease but need to grow bone?
No. At all. LANAP is used to stop gum disease and hopefully gum disease. So I don't see how really LANAP would be used in a situation where there was no gum disease. In other words, if someone had a tooth pulled and there was bone loss from that, that is not a situation where LANAP would be used.
Okay, another question from the station. How do you deal with a patient who has a very bad gag reflex?
We give the patient intravenous sedation so that they're fine when we work on them. They're asleep or so relaxed that their gag reflex is never a problem. It's one of the great reflex. It simply doesn't exist in those situations with IV sedation, and we use that almost all the time.
Dr. Nemeth, I have a question from YouTube. They're wondering what you're doing for your patients in the office to combat COVID now that the Delta variant has become a little bit more prominent.
Well, we're doing everything. Virtually all of the wearing masks. The patients are wearing masks. We check temperature. We have high filtration devices in all of the rooms. We have devices that actually are right adjacent to the patient's mouth that suck away all of the air and all of the aerosols to dispose of that. So we've taken great precautions to minimize and eliminate the possibility of COVID being contracted to our office.
I think we should talk about this when we're live because I think a lot of people are still scared to go back to see their dentist. Do you agree?
Definitely.
I think a lot of people are still, I know people that are afraid to leave their house. And the next one, they're just, I'm staying at home, I'm not doing anything.
Well, WDIV, which is the local NBC television outlet here, Dr. McGeorge came to my office. We talked to him for quite a while and told him some of the things that we were doing, which I just mentioned, and they interviewed some patients. I think we're on the forefront of making every effort to prevent any possibility of COVID transmission.
And I was going to say, when we're back on the air, we did have a caller come through.
Okay.
And a second question, but I can address it on the air because we're back in less than a minute.
You have a caller you want to take first?
Yeah, whatever you'd like. We can start
We
with the
should
caller.
take the caller, yeah.
I'm here. I hear nothing.
No, well, we're not back on yet.
Okay.
Timer seems to be off.
Yeah, no, we're back in probably 15 seconds now.
15 seconds, okay.
Someone on YouTube did.
I don't think so right now. Welcome back to this special edition of the Dr. Nemeth Radio Show. I'm your host, Anne-Marie Cronin, and we are here tonight with Dr. Nemeth, board-certified periodontist in Southfield, Michigan. Dr. Nemeth is with us discussing his state-of-the-art clinic, periodontic care, and the relationship between gum disease and many of the systemic diseases from cardiac disease to the prevention of Alzheimer's. This is our final segment, so if you have a question for the doctor on the topic we're discussing tonight, 0957, and Siobhan, you have a caller for the doctor?
Yeah, so we have Michelle from Brighton on the line. Michelle.
You know, that's very interesting, and there is evidence that hyperbaric oxygen does help destroy those organisms, because when those organisms are exposed to of oxygen. So if somehow that oxygen can penetrate through the tissues, it can help destroy those organisms. So it can be helpful, actually, yes.
Very.
Well, we don't know, but we know there are special devices that are used to get oxygen to help kill those bacteria. So oxygen is used not, but in other contexts to try to eliminate those organisms.
It's an interesting question about the hyperbaric oxygen chambers.
I'm
go
going
ahead.
to jump in. We have a question from the station. What role does acid reflux play in gum disease, if any?
As far as I know, the main role is dissolves the enamel of the teeth, and so the teeth become thin and brittle and break off more easily, and it can deface. Cosmetic problems, but as far as I know, it doesn't have any direct relationship with periodontal or gum disease.
Do we have any other questions from Siobhan right now? Because otherwise,
Yeah,
go ahead.
Actually, we just got another one on the phone. So let's go now to John in Jersey City, New Jersey. John, what's your question?
I do a great deal of patients who have gum recession. I treat a great many of those patients, and some of them have these black triangles. Black triangles are areas where the bone has receded. There's been a lot of bone loss, bone destruction in those areas, and so and to fill. Why? Because when there's no bone, there's no blood supply to nourish the tissue that we bring up to cover the roots and to fill those black triangles. So it's being filled. Sometimes we're fortunate and they do get filled, but sometimes they don't get filled. So black triangles are a problem. They're something that we're always looking for ways that we can treat those, and there's no predictable triangles with a certainty. We can sometimes eliminate them or improve them, but that's variable and can't be really counted on most of the time. I don't know that it is difficult to regenerate gum tissue. I think that's what we do in the pinhole technique. We actually regenerate gum tissue, but we do have to have a blood supply in order to give us the nourishment that we need to regenerate the gum tissue. So when we do the pinhole technique, sort of adding gum tissue and kind of growing gum tissue in areas where it hasn't been before. So, but you do need a blood supply to nourish that tissue, and if there's been too much destruction and too much, or if you've had trauma or previous surgery, there may be scar tissue, and the scar tissue doesn't have the normal blood supply that we need too. So there are complicating factors that can make it more difficult.
Well, Dr. Nemeth, before we close the end of the show, I just wanted to ask you, is there any to your office to see you? Because we're still dealing with COVID. We're still dealing with it. A lot of people are stuck in their houses. They're not going out. They're afraid to come in. How can you reassure the people that need to be seen and need to get
The local NBC television outlet here, WDIV, Dr. Frank McGeorge was recently in our office and was interviewing me and a number of other, and some of the to prevent or allay patients' fears about COVID. And we're doing pretty much everything possible. We have high volume filters that we put right next to the patient's mouth when they're working on them, which removes any aerosols or any air that may have come out of the patient's mouth, and that's completely removed. Each operatory or room has its own separate air filtration system. Everybody's wearing masks. All of our clinical staff. We have never had, and I certainly don't know of any. I believe we've never had a case of COVID that our office has been responsible. I'm talking about never. We take ultra precautions to minimize that, and it's just not a problem. Patients may be concerned, but they have really no reason to be concerned. There's more concern about not going to the dental office because of the damage that can occur because they're undiagnosed or their gum disease isn't being treated, and that's much more damaging than the chance of them getting COVID from coming to the dental office.
That's good that you're giving that kind of reassurance because I think a lot of people are certainly worried about it. Siobhan, did you have a question?
We did have a caller come in, but I don't know if we have enough time. Do you think we have enough time to
Go
take
ahead
another
and let's
caller?
try it.
Sure.
We've got
Okay.
1
All
minute.
right. We have Shane from Detroit on the line. Shane, if you could ask your question quickly, we're coming to the end of the show.
I'm great.
Good. What's your question, Shane?
I think hydrogen peroxide periodically is fine. I think if it's used on a daily basis, I've actually seen it where it can cause an overgrowth of certain fungi, and I've seen patients that have what's called, it sounds disgusting, black hairy tongue, because they've been using hydrogen peroxide every day, and in some fungi that can actually, you know, kind of be disfiguring. I don't know that it's dangerous, but it certainly is not something that we find desirable. So occasionally hydrogen peroxide is okay, or low doses, but I'd be reluctant to use it every day as a standard.
Well, unfortunately, we're out of time, and that wraps it up for the Dr. Joseph Nemeth Show on News Talk 760 WJR, sponsored by the North American Society of Periodontists. I'm your host, Anne-Marie Cronin, and again, I want to thank Dr. Nemeth for talking to us this evening about taking charge of our health, being proactive, and avoiding the devastating diseases of our time. To take a closer look at his practice, please go to YouTube and search Dr. Nemeth to see his videos on his state-of-the-art treatment modalities. Directly at 248-357-3100. That's 248-357-3100, or by visiting him on the web at drnemeth.com. Again, that's drnemeth.com. We hope you've enjoyed this, informed about periodontal disease and its impact upon the major diseases of our time. Thank you for listening.
Nice.